Hi, I'm Joe Chile. Mornings from 7 to 9 with Buffalo's classic oldies from the 60s and 70s on the Big Weck. Joining us on the Big Weck's Buffalo on the Rise today is Jennifer O. from QC Kinetix. Jennifer, welcome back.
Glad to be here.
You've been here with us before. You know, I don't want to say that it's an improvement over Keith, you know, because Keith always joined us before too. Tell us, we want to talk a little bit about regenerative medicine today. And why would somebody go to QC Kinetix over, say, a regular doctor for regenerative medicine?
Well, we encourage people to see their regular doctor, whether it's their primary care or orthopedic surgeon, but also find out what it is that your condition is, what is the source of your pain, and then come see us because you want to get a full array of your options. Surgery or drugs, oftentimes that's the only option given in traditional healthcare, and regenerative medicine for many is a great option where you're actually healing the source of your pain versus like masking it with drugs or surgery, which is pretty invasive.
You know, and you know, label me chicken, but whenever I hear surgery, I want to look for another option. I mean, you know, I understand sometimes it's a last resort, but
Right.
I want other options. When you start talking about people that are coming to you for regenerative medicine, is it traditionally older people? Is it young people too? Is there a mix?
It's a mix. You can be 18 to 85, really. Our median age patient is about 62 years of age, so that will help you to understand, because usually by the time you are in your 50s, you are starting to feel some aches and pains due to wear and tear, or just a sports injury or multiple injuries from the past that kind of accumulate in your joints. So yeah, we've treated college-age athletes who want to stay competitive in their sport and keep their scholarship, all the way to young moms and dads who who for whatever reason is having lower back pain or knee pain, oftentimes due to injuries from the past. And then as we all age, we all get osteoarthritis. So that would be the majority of our patients. But yeah, definitely patients of all ages.
So if someone were to come up to you and say, you know, I'm dealing with such and such, and I guess I'm just going to have to live with it, your answer would be?
Why would you want to live with it? Because really every day is a gift, and your quality of life is really the whole difference between living or just existing.
Right.
Yeah. So I would say, what's your true motivation? What do you want your life to be? And wouldn't you want to pursue the best quality of life? That's what we're offering here.
What about some success stories? Recent success, can you?
Oh, yes. So I have just had a patient in this morning. He was on his last treatment, 69-year-old, big auto mechanic business. He's working, huge staff. And, when you're working with your body and your hands, you get a lot of wear and tear. He treated his hips, he treated his shoulder, and after the first injection, his staff told him, "You're walking differently." And he's like, "No way." And his staff noticed after his first injection that his whole gait changed because he was relieved from some of the pain. And it was his last injection. He said he's so thrilled. It was the best thing he ever did.
And he's 69.
And he's 69 with a lot of wear and tear.
Do people, do you think, come to you sometimes as a last resort?
I would say the majority come to us as a last resort, unfortunately. Hopefully with more and more education, people will want to intervene sooner, because the sooner you intervene, the greater your chance of getting complete regeneration, complete healing. sooner and at a much affordable price.
What would you say is the most common question people ask, maybe during a consult that they have with you?
Why isn't this covered by insurance?
That's a good question.
Yeah. Why, if it's so good, why doesn't insurance cover it? And I would say that insurance and the healthcare system is a profit-driven healthcare system. So usually intervention is not as profitable as invasive treatments. Invasive means more expensive, which means, more revenue for them. So unfortunately, there's a lot of different interests that govern, including insurance and what they're willing to cover. But we are starting to see some PRP being covered as a reimbursement for some insurance policy holders.
So if somebody's watching today and they say, I have something, pain, regular pain, chronic pain, whatever, what's the first step? We have about a minute left.
Sure. Call the number, find out if your pain area is something that might be something that we can treat, and schedule a consultation. It's free. You get a complete medical exam in relationship to pain areas. And then you'll find out if you're a great candidate. If so, custom protocol is developed for you, and because everybody's pain story and pain area is different.
Jennifer O. from QC Kinetix, thank you very much. We appreciate it. For more information and answers to your questions, contact QC Kinetix by calling 716-222-9595 or go to qckinetix.com. Sponsorship and promotional consideration for the preceding segment was provided by QC Kinetix. Start your weekday mornings with me, 7 to 9 a.m., and Buffalo's classic oldies from the 60s and 70s on the Big Wack.